What are we doing today?
Okay, Travis.
All right, good afternoon, folks. It is Wednesday, November 19th. It's 1 p.m., and we are going to call to order the Health and Human Services Committee. Is there any changes to the agenda? No? All right. Do we have any public comment? We do have no public comment. Minutes approval. Do we have a mover to move the minutes? Amanda moves. Shauna seconds. All in favor? All right, we are moving. The chair's report. I have a few things, but what I would like to do first, since we have a guest, is invite Frank Krupa up to talk about give us an update on the intensive crisis stabilization center. Frank Krupa.
Thank you, Travis, and good afternoon, everyone. It's good to see folks, familiar faces. I wish I had a better update for you. We are still efforting to get the Withdrawal and Stabilization and Intensive Crisis Stabilization Center operational, but there are challenges related to the ownership of the building. As you all may recall, the Alcohol and Drug Council was the original owner and intended occupant to provide the services. The monies that the state provided to purchase the building and to make the renovations were bonded for. And so as we understand it, when they bond, it's for a specific agency for a specific purpose. And so there's still efforts happening at the state level between OASIS and the New York State Department of Health from where the funds came to establish a plan forward related to the building and the construction. There are liens on the building because there are folks that are still owed money from the construction and the efforts of the Alcohol and Drug Council to stand up operations. There is, as I understand it, monies available to fulfill those deficits, but it all hinges on how the bonding was undertaken. So the legal folks in Albany are working to try to figure that out. In the interim, we have done everything we can to be prepared to submit our applications. There's multiple for the different licenses. We have done the work, the design and bidding work that would be necessary for the construction that would be needed for the Crisis Stabilization Center. We have been participating in a consortium with the other crisis centers that are trying to open around the state and learning from them to be prepared. And we have hired on a addiction medicine physician to join our team. So she's currently supporting our efforts in Cortland, but is also going to be helping us stand up any of the new services that we provide. So we are doing everything we can in the interim to be prepared. So when decisions are made, we'll be able to move as quickly as possible. All of that being said, when the opportunity comes where we do have approvals from the state to move forward with the ever-changing healthcare environment as it is, the health system has to evaluate every new program almost in every moment when there's decisions to be made about moving forward. So, obviously that is part of the world that we live in at the moment. There's ever-changing, as you all are aware, particularly from the federal level, Medicaid impacts and those kinds of things that will all impact decision making. So we're doing everything we can to be ready when we're given the go, and we're working hard to make sure that our internal leadership team has all the information they need to make sure that we can be successful when we move forward. So that's my update.
Thank you, Frank. Is there any questions? Shauna?
I think I'm really concerned because, as many of you know, we allocated the largest amount of funding to Cuga Med for the detox center, and it was what, 1.5 million?
Yes.
And you guys have been sitting on it for a long time. And we could have given that to other nonprofits that were doing good work here. So, I think we need to have a conversation about Plan B for us. If we can use those funds somewhere else in our community, if it's too late. Because if you're now saying that Cuba Health Partners is questioning if they're going to pursue this, that also causes me pause. Because my understanding was that was definitely a commitment to our community. And I understand situations change and there's some concern about viability with Cuba Health Partners, but I mean, that was a nice handshake thing that we had all done for our community. And to know that that might not be happening, I think we need to ask Maury or Norma or who else if we can use those funds somewhere else.
Norma's here. We can ask her.
Hello.
Hello, Norma.
Yeah, so we haven't received confirmation that these were not going to be used. It will be very difficult to reallocate those funds. That's a large amount. I don't know, we can do our best, but it has to be something that had been contracted for prior to the end of the year. And yeah, it'll be very, very difficult to reallocate $1.5 million.
And if I could just follow up, it certainly wasn't my intent to communicate that the system doesn't plan to move forward. There's just a lot of moving pieces, much of which are out of our control. And we're waiting for the state to give us some direction on being able to move forward. We definitely recognize the impact on the 1.5, and we very much want to see that used for the services that it was allocated for, and we're doing everything we can to try to make that a reality. We did make a commitment that as soon as we know that it's not a possibility, because the state tells us such, we would certainly communicate that immediately. We want to be a good partner to the county, and so if there's conversations to be had with leadership, we're happy to have those conversations.
It sounds like, from what Norma's saying, that ship may have sailed in terms of that 1.5, which is very concerning, as Sean has said. Amanda?
Yeah, I mean, there was like a cutoff time that we had to allocate, and then there's a cutoff time that it has to be used. So I don't remember what those dates were, but if we can't reallocate it, I think it has to we have to go leave it where it is, and then hopefully it can get to the point where it's used. I mean, I guess otherwise we just lose it, right? Like we can't, yeah. But I also wanted to say thank you for being here and for the update and for communicating clearly with us and telling us what's going on.
Corsa?
Yes, I just wanted to, based on what Amanda indicated, the cutoff date was to allocate was last year, December.
Right.
And then the cutoff date to use it is December 2026. So as long as the funds are not recalled by federal government with all the changes we are seeing, the Addiction Center will still have access to use the funds up to the end of next year. As Norma said, we can only reallocate the funding to a program that is active, to a contract that is active, but it's very difficult because of the amount, and we have very few contracts that are still active. So we'll be working with Frank as much as possible to make sure anything we can also do to assist them in moving the pieces forward, those pieces can be moved to get the funds used for what we originally intended to use it for.
Thank you. Randy?
Yeah, thank you, Frank, for being here. Sure. Yeah, this is really important, so hopefully this does work out. So the funding of this, so it was bonded by, when this building was built and renovated, who was it bonded by?
The Department of Health, I believe, the New York State Department of Health.
So technically the building still belongs to them.
As I understand it, the building is owned by the Alcohol and Drug Council as an entity. The New York State Department of Health bonded funds that were provided to the Alcohol and Drug Council for purchase and renovation to the building, which has occurred.
Right.
So that bonding is tied to the building. And it is also tied to the Alcohol and Drug Council, which is now essentially a defunct organization.
So what is the complication then? I'm trying to understand really so is this the politics or just the machine?
I think it's the legalities around bonding, and I'm certainly not a bonding expert, so I don't know how to explain this as thoroughly. I know heart of the conversation was around, does the Alcohol and Drug Council continue to exist on paper? And then have a management contract with Cuyahoga Addiction Recovery Services, which is our substance use arm, to do all of the operations and such. So that's the mechanism. We would prefer for the Alcohol and Drug Council as an organization to just no longer exist, and CARS, Cuyahoga Addiction Recovery Services, be able to just own and operate the facility. But because of the complications with the bonding, it's not that simple. And so we're waiting for direction from the state on how they feel we can legally move forward with operating the services in the building, not when we are not the Alcohol and Drug Council. So we're trying to, that's what we're trying to navigate. They're trying to navigate.
So it comes down to who's going to own the building. Somebody's got somebody, and then they would probably have to take on the bond, right?
So no, the state holds the bond, so they're responsible for the bond. But when they bond, as I understand it, they bond for a particular entity, which was the Alcohol and Drug Council, to provide particular service, which was the withdrawal and stabilization, residential stabilization. The Alcohol and Drug Council, as an organization, can no longer provide those services. So the question is, how do we navigate the bonding that was designed for that specific purpose? Right.
Yeah, I've got more questions, but I get it.
I'm with you, and I wish I understood this better and had a clearer answer, but we don't. The state has told us that they have to figure out the bonding with the Department of Health. OASIS is on board and has been giving us regular updates and are very supportive of finding a solution, but the New York State Department of Health is the bondholder, and so they have to work through them to get to a solution.
Corsa, is this something that you should jump into, or is this, how should the county be involved? That's $1.5 million. If we lose that, that's really bad news. So.
Yeah, I think with the Alcohol and Drug Council not being under the county, our oversight or our involvement could be very limited. But what we can do, as Frank said, is continue to have engagement with Department of Health to see how we can help move the pieces forward. I think probably Murray will be able to help in terms of the legality of it, but it is complicated at this point because the organization is defunct. They are not active. If they are active and they can just sell off their interest to the Alcohol and Drug Council, they can sell out their interest to Cayuga, great, but at the moment, because they're defunct, it's more of a legal process that we unfortunately cannot influence.
Maury?
I would be happy to dig into this and see if there is, what ways are available to facilitate this moving forward. I have not looked at ADC's legal status recently. When we refer to them as defunct, I would say I'm happy to look at it and see if there's some way that we can assure that that the money gets used for its intended purpose, and help smooth over what the hurdles are that are holding that up.
Thanks, Maury. I know, Frank, you didn't plan on. Cayuga Med didn't plan on this happening, obviously, right? But for us, we took a lot of heat allocating that much money to Cayuga Med. There were folks that felt like this is something that they could handle on their own, but there was this need in the community for these services. So knowing now that there's this possibility, and it sounds like it's a very real possibility, that we might be just out 1.5, looking at what our community is dealing with now, that money could have went a long way. And I know that you weren't making these decisions and you all would like to see this happen. You are working really hard. It's just kind of shocking to us now to be at this place where that's a real possibility. So it's a big deal. I know you know that. You were with us for a long time. Any other questions?
Not a question, but this can't be the only instance of this happening. where an organization, got a bond through the state or whatever, and then it wasn't able to come through. Like, there has to be other situations. So I hope maybe folks are looking at those other situations. How did they navigate that, and how did they get through it? Because I can't imagine that this is the first time this happened in the state of New York.
Jonah.
I think the other part that is frustrating, Frank, is the fact that the last time you came into the chambers, you told us that you would be opening in December. And I spoke with Marty in January, and we had a conversation, and he said, yep, full steam ahead, we're getting excited. And had there been red flags, back last December, we could have allocated the funds. And so I wish there was a little bit more transparency, because unfortunately, because the lack of transparency, this 1.5 is not going to be available.
I will say that we are certainly working to try to make this a reality still. I want to be clear that that's, we're still working towards that. The shifting, when I was here with Marty at that point, we were not aware of the challenges related to the ownership of the building and the licensure with the state. That happened subsequent to us being here. Fair point about when and how often we should be being clear about all of those things with you, and we can certainly make sure we do that moving forward. Things that we did not expect were going to be a challenge. They came to light when we were in the process of submitting our application for licensure, because the question was, can we submit as cars? Because that was our intent, was to submit our licensure under cars. But because that's what raised up the bonding issue, because there was then question about the Alcohol and Drug Council being the one that the monies were bonded for. So it has been a relatively new development, and fair enough. Yeah, I hear you, and I feel the same pain. You all know how I feel about this, and it's in large part why I came over to Centralis and Cuyahoga Health, was to try to help make these things a reality for our community. So we will do our best to work with county administration and certainly answer any questions that you guys have along the way.
So now I have to ask, if we're now in November, I think, if I remember correctly, the plan was to open part of this in December. So when did you apply for the license?
Back in, I want to say August-ish.
So sometime in August, early September, you knew this was an issue? You were told this was an issue?
Yeah. I think
that was a few months ago. So to Shauna's point and Amanda about the transparency, you all have known for some time now that there was major complications. I still don't know if we could have done anything with the 1.5, but my guess is we would have had a little more room to figure it out. And now we're on the 23rd hour here, and our options are extremely limited. So it was a lot of money, and you all have known for some time that there was some issues, and there was no sharing of that information with us. So that's really disappointing, to be quite honest.
Fair.
Any other questions for Frank? Amanda?
Yeah, just trying to have hope here. So we have, we have until the end of 2026, am I correct?
To spend it.
To spend it.
Correct.
Is that going to happen? Like, how long do you foresee it taking to work out these issues?
So there still is a path forward to completion before the monies are due to be spent. There are unknowns, particularly related to the state decision-making, that we don't have the answers to. But we, as I said before, have done the work to be prepared, that the window is still open. And it will all come down to decision-making at the state level, and then ultimately, evaluation of what that decision-making is and how it impacts the project.
Right. So I guess to someone's question, if there's something that the county can do to push the state to say, get this done because we have these funds tied up, you know, and put pressure on them to get it moving faster than they normally move. That, you know, that would be something that we should do.
Randy?
Yeah, I agree with that, Amanda. Yeah, Maury, I'm looking forward to maybe you can figure something out here. And is it county ownership? Who owns the building? Maybe that's the issue as to who owns the building?
No, we know who owns the building.
I know, but who would own the building? Is that the problem once you, because that was the plan for acute medical cars to own the building? Was that the plan?
Eventually, yes. What we're looking for now is clarity from the state that cars can operate the licensed services in that building. That's essentially the question at hand.
Right, but technically it's still under the Alcohol Drug Council's
Correct, as I understand it.
control. So yeah, it's going to have to be a transfer of ownership issue because no matter what, they're not there, right? It never will be.
Right.
So,
Yeah.
all right, well, we'll see what goes.
Yeah, I think we have to get our head deeper under the hood of this to really make it happen. And hopefully Cayuga Medical and its counsel's office will cooperate with respect to that, because it really would be an awful waste if this doesn't come to pass.
Anything else, Frank?
No, I think that's enough.
That's enough.
Thank you all for having us.
Thank you.
Keep our fingers crossed.
Yes, hopefully it all works out. We were supposed to hear back from county administration some time ago on our request to have some plans to choose from to move forward for the Office of Human Rights. So, of course, I was wondering if you could give us an update on where we are with that.
Thank you, Travis. Okay, so as you remember, a couple of months ago, myself and the chair of the Human Rights Commission did a presentation, and the key element of that presentation was to maintain the Office of Human Rights and also to highlight the key important attribute of the office to the community. The significant portion of that document was to actually enhance the office operation and add additional bodies to the office to make it more responsive to the community need. In line with that, the conversation then became what other options are available for consideration. I did not work through developing different options, but my thought process during the budget and also further engagement with the Human Rights Commission was the fact that the office was understaffed. There was a position that, due to an error, was eliminated during the budget process a year or two ago, and we tried to restore that position. During the budget review process, the key concern was the office is currently not staffed by a director. We only have one staff in the office. The office is actually not active. So why don't we fill out the position that is vacant and provide a new director an opportunity to review the office and come up with a proposal of a direction for us to move in? Additionally, there was the questions around, should we change the position of the director to maybe education and outreach coordinator and expand the role of the CEDO to oversee the administration functions of the office. But like I said, my previous roles, I did not have an oversight of such a unit. So most of the things that I'm learning is new to me. So the conversation around the CEDO and oversight also was a bit mangled with other things and other concerns that existed, whether if we do an integration of the unit, will the Human Rights Office suffer, or will the CEDO role suffer because of the interest of an individual that will fill that position? So currently where we are is to maintain the status quo. to hire a new director who will be required within the first couple of months in the role to review the outcomes of the office and also bring out a proposal for consideration of any changes that may be necessary. So that is where we are at the moment. So the position has been posted. As at Friday, we had one applicant. It's open until November 30th. And I intend reaching out to all of you in terms of the review process of filling that specific position. One thing that I would say is my understanding is that the position, due to changes in an MOU, the office is not able to conduct investigations anymore. So there's an aspect of changes to what the office, the capacity or the responsibility of the office. So it is essential for us to do a review of that office by somebody in there who understands the needs and also be able to produce a document that we will be able to share with all of you and decide on which direction we want to go. I think the fear when I came into the role beginning of this year was the fear of eliminating that office. And that is what my conversation with the commission members and other community members came to a point that the position is very critical to who we are as Tompkins County, and we need to maintain that. But beyond maintaining the office, we need to be able to have the position filled and do a bit more introspection of what is really needed and propose something somewhere in the middle of next year, depending on when we can fill the position for consideration during the 2027 budget preparation.
Thank you. Randy has a question, but I want to say this first. I think part of the reason why we asked for options for what the office could look like is what you said at the very end, that for quite some time now, the office hasn't been able to lead investigations. It hasn't been able to investigate at all. And so if we have an office who can't conduct investigations, what is the role of that office? Payee, when you did the presentation, said that she read some laws that said they could, and we were supposed to find out if that was actually true. Whether the CEDO oversees the office or not really isn't the biggest question for me. The bigger question is, if the office can't do business as it was put together to do we need that office to look like it does? For some time now, they have done community education and programs, and so are we paying a department head to do programs? To me, that's a program planner. There's other positions within the county that would do that type of level of work. So that's what we were hoping for, I think, and I don't want to speak for everybody on the committee, was to get a few options of what the office could look like moving forward, knowing that it can't do the work that it used to do several department heads ago. So when I think about now hiring a department head who's going to get paid to tell us that they don't need themselves to be the department head because they can't do the work, I don't want to, we're so far down the road now of hiring somebody, it's posted, to tell us what needs to be done. They certainly aren't going to eliminate their position or say that their work isn't needed after they get the job. So I'm a little concerned that we have the cart before the horse without a plan here moving forward. I know we got caught up in budget season and there was a lot happening. We had to get everything set up for Code Blue. We had a lot going on during that period of time, but now we got a position posted for a position that may not be needed in the way that we've had it now for some time. Randy?
My question was answered by Corsa about posting. So, but I agree, options is where we need to be. And is it an option for, is it right now, any investigations are out of Binghamton, I think? Is that correct? Could they have a satellite office here and we support that so we can do our own investigations? So what are our options for that kind of stuff, right?
Amanda?
Yeah, I'm just incredibly frustrated about this. First of all, I highly respect the Human Rights Commission, the people who are on that, who dedicate their time and their energy, volunteers. I don't think they should be on the front lines assisting people, people who walk in with issues. That's not their job. That's the job of an employee. And it concerns me when payee has come and said, we're overworked, we can't handle all the people. Like, that's not their job. That's the job of the Office of Human Rights. And the commission is not the Office of Human Rights. I feel like they are putting themselves at risk. We're putting the county at risk. Maury can chime in on this, but if volunteers are assisting people with legal problems, or they're working with people who are unstable or, need more help than a volunteer can give them, what's to say they feel like they get bad legal advice from a volunteer and then they turn around and sue because we're providing a volunteer. It is so frustrating. Corsa, I understand that you have a lot going on. You said you haven't worked with this kind of office before. I don't think that's an excuse for putting this off. We last talked about this in August, and we have asked repeatedly. I guess maybe some of us should have followed up sooner. I don't know. I don't understand why this is not moving forward. And I agree with what Travis said. Sure, we can hire somebody and maybe they'll have ideas. Maybe they'll say, here's how the office can operate. I need one staff to be a secretary and I'll do the, working with clients. I don't know, but it's very frustrating to me that this has not moved forward.
I just want to say thank you, and I appreciate the frustration and the concern. And what I said was not to make an excuse at all. Yes, Travis is not. I don't think the cat is out of the bag yet. The position has just been posted. What I intend doing is that I will get together with Murray and also have a conversation in terms of what options will look like, and we can report something to all of you next month for consideration. Alternatively, we can always pull the position. It's just been advertised. It doesn't mean we have made commitment to do anything. What I will say is that, yeah, there was a bit of lack of clarity whether one of the questions I keep asking was, has there been a decision to completely eliminate the position? Because when I came into the role, Carmen was in the county administration office, and one of the things in my handover notes was to find a different position for her to go in. So one of the key concerns for me is, what does the office do? And I felt at the time that the best people to provide me that education and information was the commission. But we can, yes, the position doesn't, the office is not able to conduct any investigations anymore, but they also serve as the role of our county's fair housing officer. So we can work together and look at, because some of the things I could think about quickly was that currently they have been doing referrals. So when somebody comes in and lodge a complaint about something, they refer to either Law New York or other agencies to support that individual. So I felt education and outreach coordinator can help more with the office. So that was my primary desire, to fill that kind of position before even filling the director position, to evaluate the administrative functions of the office. So I completely understand that. And I share the same concern that filling the position with $100,000 salary to an individual with fringe of $150,000, and a person cannot do the real specific aspect of the investigation piece. So what we did with HR is to review the job description and eliminate the requirement for a JD, and that reduced the grading, I believe, from 88 to 86. So it's still a high salary position at this point, but we can always look at specific directions that we need to go into. Yes, I don't know if that MOU can be restored, I haven't had a conversation with the New York State Office of Human Rights about what direction they want to go in, but it appears the local offices of human rights are pretty much being eliminated across the state over time, and most cases are being referred to the state. So that's where we are, but we can get together and work out if we intend making significant changes at this point and filling the position differently from where it is at the moment.
My hope would be we are coming to one more meeting before this year's session is over, that in December there are some options, some very clear options of what we can choose from moving forward, because I don't want a new legislation to have to start over from the beginning in January. I think we need to be able to pick option A and B, option A and C in December, so that folks can hit the ground running in January and not have this drag out into the spring. Do you have anything else that you want to report on since you're up? Wait,
no,
Shauna has something.
I think majority of my report in terms of this department is related to Code Blue and DSS issues. DSS teams are there, so I will not take the wind out of their sail. So yeah, we are on course to get a facility open on Monday, and I'll let DSS provide you the details of where we are in terms of Code Blue numbers and other things that we've done over the course of the month.
All right, Shauna, you had something?
Yeah, I just wanted to pipe in. I was actually on an email last week from someone who had experienced discrimination in the workplace. She had written in to administration and had forwarded on to the Human Rights Commission. And I just want to remark about the traumatic situation that this person was going through, and she was looking for help. And at this point, I think we probably also, since the office is not operating, we need to have the conversation. If we're not able to provide the assistance that we once were, if there is a way that we can refer them to people that can help, because the Worker Center, Law New York, those are agencies that can help people go through the grievance process. But since we can't help, we should also probably talk about a dollar amount of, since we're no longer able to provide these services, and our commissioners are saying that they are also unable to allocate the time. I mean, we can't expect our nonprofits to take on work that the county was doing at one point without the compensation. So I hope that next month we can have that conversation, because I think people are coming to the county. At one point we were able to help them. Clearly we're not able to help them at all anymore. And we need to have some type of referral process, because my guess is people are really having a tough time in our community, and they're looking for help, and we need to be able to help them.
Absolutely.
Thank you. Yeah, thank you. I appreciate that, and we will work on getting something to you guys next month.
Thank you. Well, up next we have social services. We have the good folks from DSS.
Oh, okay. Going right there.
You have a few resolutions and then a report.
Yes. So the first one is for the Family Assistance Program. So this is a mandated program, also known as the temporary.
Wait, I got to do this a different way. First resolution, budget adjustment, Department of Social Services, Family Assistance Program, ID 13708. Do I have a mover? Do I have a seconder? Randy seconds. Okay.
Thanks, that's why I was thrown off. So this is for a mandated program, also known as TAM, for the Temporary Assistance for Needy Families. So we've had an increase in the amount of expenditures for a few reasons, the largest being that the use of the family-centered case management funds to provide a senior caseworker and a part-time case aide to assist families at our roadway shelter receive the services they need, which has increased with the use of these staff positions. And then another is having more families apply for services after Code Blue this year, so families who connect to Code Blue and then apply for services, and the ability to keep them at the shelter. The previous trend trends for this program saw small increases, but now with these added positions in case management and connection to our shelter after entering Code Blue, it's increased the expenditures.
Any questions? Randy?
What does AFDC mean? That's where the revenue is coming from.
It's an old acronym called Aid to Dependent Families.
Okay.
Thanks.
Any other questions? We ready to vote? All in favor? All right, so unanimous. Second one, budget adjustment, County Office for the Aging, Unmet Needs and Department of Social Services, ID 3718. Amanda moves. Shauna seconds.
We teamed up together.
Nice. Collaboration, I love it.
If you want.
If you want to start, and then I
can
can
talk.
into this.
Yes, so, did you second it already?
Oh, yeah, we're ready to
Okay,
go.
all right, sorry, now I'm confused, I'm sorry. Yes, so, because of the benefits that were on pause at that point, we decided to work with DSS to provide some funding for older adults, people over 60 that had difficulty, getting to food banks and preparing the meals, possibly that they would get food from the food bank. So these are prepared meals that we are providing with this funding up to $50,000. We probably won't go through that much, but working with FoodNet to do that, and it's being managed by DSS.
Yes. So it ties into the other budget adjustment here. So I'll just talk about it all together.
Okay.
If that's okay, or do you want to move that at the same time?
I think we got to do one at a time. Do we have to do
Okay.
one at a time? We have to do one at a time.
Okay.
Yeah, I mean, you can explain it, but
Yeah.
the other one we have to vote on separately.
Okay. So in terms of the meals provided, I can give you some data on that. So we've provided 88 meals on Monday, 88 meals were delivered to 28 individuals in Freeville, and then staff will be making a second delivery this Friday to Trumansburg residents. And as of right now, there's 10 residences who will receive meals, and then they are doing additional deliveries to the surrounding areas next week, to the surrounding rural areas.
Got you. Any questions? Randy?
So these are frozen meals?
Yes.
Okay. And how many meals would this money provide?
Oh, I don't have that number in front of me, but we
around
figured,
500.
yeah, per week, 500 meals per week, as long as it went out and expended the money. I'm not sure how many, but total, it just depended how long it goes on. I don't have it off the top of my head of the total, but we did figure out an end total because we only had so much money.
And now that the federal benefits have been restored, there's less of a need.
Yes.
So,
I mean, we will
That has some
continue it a
numbers.
little bit. I think we're going to offer it for people that are struggling, that have heat paused as well, and at least they can, have some food so they can pay their bills, or, vice versa. So it will kind of continue, but not to this level since SNAP's back in effect.
yeah, and even with SNAP restored, it's still supplemental, and there are still, especially older adults who will struggle to get connected to a grocery store, or go to the grocery store, or go to the pantry store for various reasons, either leaving the house or transportation. So having staff able to deliver those meals has been helpful.
Dina, looks like you have some orders for us?
So the total number of meals we can provide is over 6,000.
Thank you.
Thank you. Amanda?
Okay, I'm sorry. I guess I'm not understanding how the two resolutions, are related, or are, I'm not are they the same?
Can I?
I don't have the second one in front of me.
Dina, can I- yeah.
So the first resolution is the budget adjustment that COFA is transferring the money to us
Okay.
for unmet needs. The second resolution is for us to spend the money to contract with FoodNet to provide
Gotcha.
the meals.
Okay, thank you. That makes sense. And then I would just add that a couple months ago, I went to FoodNet and scooped food and helped make the meals in the morning, and it was super fun. And I think if you haven't done that, you should go do that and just spend a couple hours and, talk to I mean, they have it so dialed in. It's incredible. They have these machines and yeah, it's great. Go do it. It's fun. And it's fun.
And if you're busy in the morning hours on Friday, you can come scoop food in the evening at GX Annual Harvest Fest
That's right.
from 5 to 7:30. Are we ready to vote? All those in favor? All right. Now, the third one, which relates to the second one, Budget Adjustment, Department of Social Services, Tompkins County Office for the Aging, COFA, and FoodNet, ID 13719. Do I have a mover? Amanda moves. Shauna seconds. All right.
So this is so we can spend the money that COFA has given us. So that allows us to spend it on, so we had to buy some freezers to be able to store all the meals. So we have those. The freezers can be used after these meals after we're done providing these meals, they can be used for other purposes. So it was able to do that, able to transportation, staffing, various things. So,
All right, any questions? Ready to vote? All those in favor? All right, that passes.
Great. Thank you.
I have a question. Before you do your report, Brittany, I have a question. When y'all came last time, you talked about the success for the case manager or caseworker that was getting families into long-term housing, right? So I've been wondering for some time, when we talk about shelter needs, housing needs, when I think about doing services different, just like this, how does it change our need in this county? And I think one of the difficulties I know I've had over the years trying to explain how services can lower costs, is there a way, and you certainly don't have to figure this out today, but is there a way to look at the average length that families stay in shelters and what that costs the county, and then what the cost is for a position to move those families out of shelter and into long-term housing, and see how much money the county actually saves on the shelter housing? Because if we're having this amount of success for families, I kind of think maybe we can have some success for individuals, and maybe there's another person needed for families. I don't know, or maybe they can kind of split. So one of the questions the question that I have is there a cost savings for the county by providing that service because we reduce the amount of money we spend on shelter needs? And if there is, then I think maybe a few of us should be working on legislation to get you all more funding, because in the long run, we put people in a better situation and we reduce the cost on housing.
Sure. So, yes, we will save money by the next meeting. Is there there's a meeting in December?
Yes, there is. It's on a Monday
I'll put together a worksheet that shows all that information you're asking for.
Thank you. And do you want to do a report?
Yes. So I will say we absolutely have a need for more case managers for our adult individuals at shelter. Right now we have one who is providing services to everyone at shelter, and her plate is very full, and she's doing a great job. So I have some shelter numbers. So right now we have in our THA shelter at Roadway, we have 32 adults and 2 families, that total 8 persons. We have 27 adults in hotels and 67 total. For Code Blue, we have 1 family at Roadway and 21 adults in hotels, 23 people total right now. So we're on track to open the Code Blue shelter on Monday. It will open first as the warming center from 8 a.m. to 4 p.m. and then from 4 p.m. to 8 a.m. it will operate as Code Blue. So essentially it's open, well, it is open 24/7, but it's 2 separate programs, but nobody will have to leave. So yes, we are on track to do that. We had 4 tours on Monday. We had tours with legislators, law enforcement and emergency response and first responders, partner agencies and neighbors. I think that went really well. It was good for people to come in, see the space, reminded reminded people to focus on, the positives that we have going for us this year with Code Blue. I think it's easy to look at the negatives or focus on the negatives of the space, but compared to last year, the space is bigger, which allows there to be more space spread out for people. We have separate areas for more privacy, a separate women's sleeping area. There will be dogs allowed as a as-needed basis on a case-by-case basis because that comes with a lot of things, a lot of nuance there. So case-by-case basis. We have food, it's 24/7. We have case management, we have services. So I think there's a lot of improvements overall, and so focusing on that rather than focusing on maybe the place isn't it's not as beautiful as we would like. We would have liked to paint the floor and would have liked to fill or painted the walls. So, we have some things that we're working against, but focus on the positives. And then other things in terms of the SNAP. So SNAP federally has been restored fully. All SNAP recipients in our county have received their benefits now. In response to SNAP being shut down, we had worked with the Food Bank of the Southern Tier to get 225 emergency food boxes out to our rural communities. So we delivered, well, I shouldn't say we, I should say Roy and his other volunteer escapes my name, I'm so sorry, escapes me, I'm so sorry. But Roy and another volunteer with the Trumansburg Food Pantry and with help from Regional Access delivered these boxes all day. It was really wonderful. So boxes were delivered to Brookendale, Dryden, Freeville, Groton, Lansing, Newfield, and Trumansburg. Enfield wasn't on that list because it's our most well-resourced pantry, so they received the largest distribution, but boxes are available. People are connecting to the boxes, so that's great. And even though SNAP benefits have been restored, HEAP is still not funded as of right now. We're awaiting more guidance from OTDA, but as of right now, it's still not restored. So individuals who are maybe have their SNAP benefits are not receiving HEAP and could still be struggling to decide what they're going to pay or buy. So,
I was able to attend the tour on Monday, and it's interesting. I think that because this county and all the affiliates, the nonprofits and partners do such a good job in helping people, and people care so much, I think the expectations are very high, and rightfully so. This is our county. This is what we expect. But I really appreciate your comments at the end of the tour hours. You said some of the things you just said now. Let's focus on what's better this year. Let's focus on what we have going on right now, and I think it's a pretty incredible operation that was stood up in a very short period of time. I do think there was a lot of care and compassion that went into it. And at the end of the day, hearing what people talked about last year, and I know that was we only had a limited amount of time and a limited amount of options to be where we are now, to be able to have a service provider in there, to do all of the things, I think is pretty incredible. And for people who have lived in other counties, for people who have had these needs in other places, they know what it looks like. They know what it felt like in other places to have to sit in a chair, from 6 o'clock at night to 8 o'clock in the morning for 2-3 months at a time and never be able to lay down. Like, those folks know. And so I really appreciate what everybody collectively has done to make this happen, and I appreciate your words at the end. Let's focus on the good things that are happening right now. There's always room for improvement, and at some point in time, there'll be a brand new building for this. And going into next season, we might be able to get floors done and those other things done. But all those cots, all those beds, the washers and dryers, and people being able to shower, I know firsthand what it felt like last year, having to go from one place to go to a shower, put your stuff down, have people that would never know your business now know your business because they happen to be working in that building. So I think we're off to a really good start. The other thing I would be interested in just in case we experience this next year, and maybe you could talk about it in December, what did we learn from the Code Blue experience before the shelter opened, so we can kind of dial in next year the things that we could do. I think no matter how good we do, there's always an opportunity to do better. So I just would like to know from you all, just feedback on things you might do differently next year, so that we can just keep doing things better. Every year we can build on the successes that we've had. Anybody else got anything for Britt? We'll go with Amanda first.
Okay.
She's wearing blue that I could see.
That's right, wearing blue. That's right. Yeah, agree with all of that. That's, it's great. I really appreciate the work that has gone into this. I know it hasn't been easy. So thank you. And I guess just going a step further, I mean, I won't be here next year, but I really hope that even into the spring, you know, you all will be looking ahead and planning ahead and, you know, being as proactive as you can about preparing for the next season, because we all know the next season comes very quickly. So thank you for all of that. I guess my question, we've heard a lot about folks with dogs, and I was remembering that our first legislature meeting, the beginning of this year, there was a gentleman who came in who could not get into the shelter because he had his dog, and it was pretty, I remember.
The hotel, he couldn't get into the hotel.
Right.
The hotel wouldn't take him.
Right, and we were all kind of like, you know, caught off guard, and, you know, I mean, obviously this is a thing. People have pets and we have to accommodate that. So you said on a case-by-case basis. I guess I'd like to know what that means, but also, like, not as a like expert on this, it seems like it wouldn't be that hard to have, you know, a couple of kennels in the building where a person could keep their dog. They might not be able to be in the, you know, right next to them in the room, but the dog could at least be warm and safe as well. So I guess I'm just wondering what the plan is for that, or how you're handling this.
Yeah, so VOA is operating the shelter, so ultimately a lot of this sits with VOA, but what I can say is that the case-by-case basis, what we're looking at is, you know, is the animal safe? Are others in the building safe? There's a lot of liability that comes with allowing pets or animals into shelter. If there's God forbid, there's a parvo outbreak or we have a flea infestation, shelter has to shut down. And then if we have, last year at one point, we had upwards of 66 people at shelter. And if we have, you know, something like that at shelter and we have to shut down, we now have to find housing for 66 people. And so that's always something that's in the back of my mind and in the back of VOA's mind of, you know, let's look at the situation. We know we have individuals in the community who have, who are unhoused, who have pets who we know will seek shelter. And I know VOA has talked a lot about a woman that they work with who has a 17-year-old dog that is very small, just chills, doesn't have issues, not aggressive. So I think when we're looking at like this case-by-case basis, it's, you know, is the animal safe? Do they appear like they're in good health? There's so many things to the pet piece or to the animal piece that have to be taken into consideration. And I think, you know, we're also learning, and we hear the concerns of the community, and this, you know, this is a concern that's very important to a lot of people. It's important to me, it's important to our staff. So we are looking at ways to address it, but that piece of, you know, if something bad happens that can, you know, derail the whole operation, we have to find housing for people. That's the reality. So I think, you know, we're taking this a day at a time, we're learning from it, we're willing to try it, let's see how it goes, and if it doesn't work right, we're going to have to backpedal, and we're going to have to think about how we're looking at this, and I think that's really important.
I think one of the things, I got you, Jenny, one of the things that would be helpful is to invite VOA to the December's meeting. Okay. I don't want to ask you all questions that you can't answer because you're not the operator, so I think in all fairness, they should be able to field those questions. and tell us about what they're doing. And not every one of us has had the opportunity to meet with them, talk to them, and hear from them. So I think that would be helpful. Jenny?
Yeah, I was just going to note too on the pets perspective, you know, I think we deal with pets on the other end when there's issues with rabies and pet bites. So I wanted to sort of offer on, I hadn't thought about this until right now, but you know, we have a rabies clinic in December. That's in Lansing, transportation, mixed bag, but we can also, you know, if there are questions around pets being vaccinated for rabies coming into shelter, I would imagine that comes up. We're happy to try to help connect and make sure that those pets can get vaccinated.
Great, thank you.
Amanda?
Could the health department set up a free vaccine clinic at the shelter at some point this winter?
It's nice we have Skip on the line here today. Who's going to be joining us for our section. I mean, I think we could certainly take it back. We have 4 rabies clinics throughout the year.
And wonderful, and I've utilized them, so thank you.
Yeah, good. So yeah, we could certainly sort of take a look at our veterinarian partners that we work with on those and see if that would be possible. I think it's not out of the realm of possibility for sure.
And there's the possibility of teaming up with the folks that come down to Southside once a month. And maybe we can do some collaboration with Southside. So between the two entities, maybe we can figure out something that would meet everybody's needs. Shauna, you had something?
Yeah, I just wanted to say that from last year to this year, it feels like whether you walk in DSS, whether you walk in the tour or the neighborhood meeting, there definitely feels like a culture shift. And that's something that as a legislator is really refreshing, because this time last year we were, last night we were being yelled at, but this time last year we had a room full of very upset people because of there was definitely a culture that people felt like they weren't being taken care of. And I think once that culminates for years and years and years, we're the ones that hear about that. And it's hard for us to have accountability to our constituents if there's no communication and if that information is not getting back to you all. So I just want to say I appreciate opening up the conversation. I also think that Volunteers of America, whenever they first gave us the presentation, I was a little bit skeptical because I was like, sometimes, you know, they're saying what we want to hear. And speaking with Rob and Lisa at length a bit, their philosophies are very true to, I think, what we believe here in Tompkins County, meeting people where they are, the harm reduction idea. And I think it's important to have boundaries within housing. And I think they're very clear about the expectations and boundaries, which I think is important. But I also think they understand love and grace. And I think that's, for the individuals that we're trying to take care of, I think that's part of the conversation too. So I've been very impressed by them. And I think that people, whenever they walk through the doors, they're gonna also feel that same sense of just respect. And I think that's essential in taking care of people. So. Yeah,
to piggyback off of that, even the security folks seem very grounded in the work, not grounded in the work of security professionals, but that's part of it. But they're grounded in the work of taking care of people, the way they talk. And that was impressive to me, and I think that's extremely helpful given some of the issues that folks are dealing with and struggling with and things we've dealt with in the past. So I'm excited to see the tides change and the culture shift, and to see how well we'll be able to take care of people this year and moving forward.
Yes, absolutely. Thank you all for your kind words and feedback and questions. We will invite VOA to the December meeting. And then in terms of looking ahead at next year's Code Blue and what we've learned from this year's Code Blue, I hear the concerns, I get the emails, and I do my best to, I respond to every email, and I do my best to, get right on top of this and start looking into the concerns, and get back to people on what they are and figure things out. And, I hear the concerns of the protesters last night, and I have reached out to set up a meeting with them, and hopefully that will be happening on Friday, to just, talk with the community, to hear from them, to get their feedback, and learn moving forward on what can we do and where can we make changes, where can't we make changes, and how can the community help us fill, the pieces that maybe DSS can't do.
Thank you. Randy?
Yeah, thank you for coming in person too. I think it's really important when you come to these meetings. I think this is my favorite committee, and to have the conversations when you're here in person just means a lot.
That's it.
Yeah. So it doesn't mean something. It really does, and it is a cultural thing, and that's where it begins when you have the conversations. On Travis's point on the cost kind of analysis, one thing I believe that a project like Second Wind Cottages makes a lot of sense. And so understanding what's the minimum size of the structure and that the state will pay for, right? Or that we can get assistance for housing. When you're spending so much on hotels, when you add that up at $100 and some per night, it adds up really quick. So that kind of analysis and understanding of what's the minimum structure that we would need for people would be helpful. And also, I just want to thank people I'd like to take a tour if there's another one coming up, either Friday or this weekend. I'd like to do that. I'd like to thank the effort of everybody involved in getting a operator for this. I think that was a really big improvement and a help to the county as well. And I know that happened quick, and I'm glad we found a good one. But I have gotten to know a few people who are homeless over the last few months, and one of them is at Roadway now, young man, and I hook up with him a couple times a week, and he does some things for me, but he moved here. And he was told to move here from Syracuse because Ithaca is the place to come. And he is a nice kid, 21 years old. I don't know if it's a conflict of interest or not, that I'm lecturing this kid an awful lot and trying to help him because he's a good kid. But he's just got issues. So we talked about this earlier. Where do people come from? And so he also told me that initially DSS didn't have a place for him, so they sent him to a hotel in Elmira, which I think we probably paid for. I'm not sure how that works, if it's something that we pay for or they pay for or whatever. Then also I know a person that was in the hotel that got kicked out of the hotel in that particular county and was sent here. And now we're taking on it, and he got kicked out because of violence. So my point is that we need to help people, right? And I think we're probably more welcoming and providing a better service than a lot of other people. But is it fair, right? When people say, well, just go to Tompkins County and we're gonna foot that bill. And maybe we're willing to do that. I don't know, but I just wanted to share that information with you. I was surprised that how the system works. And and I asked him about the condition of Roadway. I said, is your room warm? He said, yep. I said, are the people friendly? And he spoke highly of the people there that were managing it. And of course, there's complications with everybody have different issues there. Drugs are prevalent there, and they do a good job of trying to monitor that, but they can leave the facility, right? And come back, and you're not searching them, those kinds of things. So I just wanted to share that. So thank you.
Thank you, Randy. Anything else, Brett?
I don't have other updates. No.
All right. Lisa, since you were kind of involved in this whole resolution stuff here, I'll let you share about COFA. Do you have anything you'd like to share?
Yeah, thank you. I just wanted to, say that we're in the middle of our high cap Medicare open enrollment. It ends December 7th. Working through that. We've been busy. Our counselors at COFA are booked out and through the end of the enrollment period. And Lifelong, our partners, are close to being booked as well. So we're starting to follow the state's overflow process that we're required to do. There's been a lot of changes to the plans. There's a lot of increased costs for 2026. So with this and the pause in benefits, it's starting to be really difficult for people, especially that are on fixed incomes. So people are struggling. I also wanted to announce we have a presentation coming up. It's called Aging, Care, and Community Planning. It's a presentation we're going to have at Library Place on December 3rd at 2:30 to 4:30. It's with Cornell students from Dr. Mildred Warner's city planning department. So there's 5 groups that have done reports this semester on our age-friendly business project, which is being kicked off right now. Caroline's emergency preparedness, local government role in caregiving, inclusive zoning practices, and then there's going to be an interactive activity using aging as a means of promoting inclusiveness for all. So yeah, so that'll be good. If anybody wants to come to that, it's, again, it's Wednesday, December 3rd at 2:30, Library Place. So that's all I have to report.
Cindy, I want to plug you in with one of my staff at GIAC. They are starting this once a week hip-hop chair aerobics for seniors. They did it with some of the seniors in our senior program, and they absolutely loved it.
Oh, that's great.
So you may have some seniors that want to get involved. So I will connect you to, and then she could share with you the information.
Great.
Have you attended senior?
Not yet. I have a few years to go, Smarty. But I was in the gym while they were in there, and they were having a ball.
Oh, that's great. We'll add it. I'd love to add it to our website just as resources for in the community.
All right, cool.
Thank you.
Jenny from Whole Health, you were, I'm sorry. Sorry.
I was just gonna, you mentioned Library Place, and I was wondering if you know, the building changed hands. Is Lifelong still able to use that space?
Yes.
Okay.
Yeah, it's going well.
Okay.
So, yeah.
Great, thank you.
Thankfully.
Sorry, Amanda, sorry. Now to Jenny from Whole
We have a
Health.
resolution.
I know.
Yeah.
I know, but
And then I have updates.
I was just excited because Randy and I were up there last week to cut the ribbon and say a few words, and I was blown away by the department and the conversation, the tour. I think I spent like an extra hour and a half talking to folks from the counseling department. I don't know if that's what you call it, but they were counselors. And we're talking about all the possibilities of them getting into the community and the work that they were doing, and the fact they don't have a waiting list for people to make appointments. And I think when a lot of folks talk about mental health and appointments and counselors, people think of family and children's services. That's what it's called? I always get mixed up with OCFS. But we have this department with all these great folks that have openings. I was really impressed and blown away and really excited in the work that you were doing. I know you have a resolution. I'm going to get to that. But I've been holding this, Jenny.
That's all right. I'm writing this down so I can go back and relay this to my staff because they'll love to hear it.
So we'll go with the resolution. Resolution, authorization to accept Rural Community Assistance Partnership, RCAP, Solutions Incorporated, donation of services for technical assistance in updating and developing sections of the Tompkins County Sanitary Code, Whole Health Department ID 13682. Do we have a mover? Shauna moves and Amanda seconds.
Thanks. So this is a little bit of a wonky one. I feel like all my resolutions are always a little wonky. So my understanding, and I've got Skip on the line who can correct me if I get this wrong, is that New York State has a program to help local health departments update their sanitary code. This comes through this technical assistance group whose name you just spelled out, and they basically end up providing services to us kind of in kind, if you will, to go through and work on our own sanitary code. And I will pass to Skip to tell us all how long it's been since our sanitary code has been updated and why that's important. And I trust you all have met Skip over the years. He's a longtime Whole Health employee, but he is newly the Director of Environmental Health within the last few months. So also I think this may be your first HHS meeting, Skip, since you've stepped into that role. So I'll pass the mic to you.
Thank you, Jenny. Good afternoon, everyone.
Good afternoon, Skip.
Yeah, so it's been a while since our sanitary code has been updated. I think close to 20 years. And certainly it doesn't always align with updates to the state sanitary code. And in terms of sewage, we've had some technology advances that we would like to potentially incorporate into our code, and look at other things as well in terms of real estate transactions, doing sewage system inspections and possibly looking at individual wells to make sure that they are satisfactory in terms of the bacteria in the water before a sale happens.
Thanks, Skip.
I don't know
So
if you
this
have
one-
any questions, I'm happy to answer them.
Anybody questions? Randy? Amanda? No? No questions? We ready to vote?
I guess so.
All those in favor? All right, that passes unanimously.
Thank you. I do have a couple of other updates. I was also going to mention our ribbon cutting. Thanks so much, Travis and Randy, for coming by. I felt lucky that Randy was able to sync up with one of our children and youth therapists, so they talked each other's ears off, which was great. We had a ribbon cutting for our mental health satellite clinic at Brown Road, celebrating the 1-year anniversary. It was nice. Congressman Josh Riley was able to join us. He was in town for that. And it was a really wonderful event. I think we filled the room, and it was great to see folks on tours, and we're obviously so excited by having that work there. So that was sort of our big event. I also wanted a very quick update, sort of as a little bit of an FYI. There was a chickenpox exposure at the Science Center over the weekend. A child with chickenpox that's from another county that was visiting. So we've been working with the Science Center, and we're issuing a little bit of a health release update on that, probably going out later this afternoon. I think low risk, but important to sort of share the news. So, and the Science Center's been a really good partner as we've sort of navigated this. And then, I think the last thing that I wanted to bring to discussion is a little bit of an update on the CARE team and the community outreach worker program. I don't know if you follow along the city budget process closely, but there was quite a bit of back and forth around the role of the community outreach worker team and the CARE team. And the way, historically, as I understand it, in the past, the county has funded half of the community outreach worker program, and the city has funded half of the community outreach worker program. Those two halves made a whole. It was a small pilot project that was run last year by REACH. At the moment, what the city did in their final budget is they funded half of the community outreach worker program and half of a second role for a CARE team member for the Ithaca Police Department. We, the county, in our budget have half of the existing community outreach worker program, but my understanding is that there are funds from Downtown Ithaca Alliance, and the city is looking to make up the gap for that. And so the city, I have heard from both, in speaking with the mayor and with Dominic, that they intend to move forward sort of funding in full the community outreach worker program. That gives us at the county level the opportunity within the whole health budget to shift our funds over to make this second CARE team member whole, which would be, I think, a phenomenal asset for the community and a real resource for this sort of revamped community outreach worker program. So I sort of wanted to bring that for discussion with you all. We don't have anything formal on that tonight. This will happen in January. But I just kind of wanted to give an update and wanted to see if anybody had questions or anything on that.
Any questions?
Yep. Is the cost neutral, pretty much?
Yeah, I mean, we had allocated $65,000 for this, and so we will just shift it internally, and it will go towards funding a CARE team member instead. And IPD, Chief Kelly's really excited about this. We're really excited about it internally. It'll mean that they'll be able to have someone from the CARE team will be on the clock for basically the equivalent of 2 shifts. So I think that will have a real positive impact on the community. It worked out well.
I think the only question I have is I would want to make sure that their second CARE team, they're staggering the shifts, because I'm not sure it's so effective to have Monday through Friday, 9 to 5.
No, yeah, that's exactly what they would do. That's part of the reason that we're looking forward to this, because it gives them a little more coverage in the morning and a little bit more coverage sort of later in the evening as well. Yep. Great, so you'll get that, some of you will get that more formally in January.
All right.
As a budget transfer.
Thank you. Is that it? Any other questions?
That's it.
Go ahead, Randy.
Yeah, I really enjoyed coming to the ribbon cutting and speaking to therapists. I've forgotten his name, but could you repeat his name?
Dan.
Dan, right. And he was great because he goes into the schools.
Yes.
And meets with kids. And one of the most interesting conversations we had was that he said that kids' stigma on mental health is faded. I mean, he goes, one kid, hey, that's my therapist. He's in a school, right? So I think the kids are more in touch with this almost than we are. And he says that they're much more outspoken than they used to be. So I thought that was really interesting. So.
Yes, he's also shared this story with me about being like out and about in the community, and like groups of kids will see him and be like, "Oh, there's my therapist." I think it's wonderful.
Yeah, it's fun.
All right. We are going to switch over to Cindy Wilcox from the Human Service Coalition.
Hi, everyone.
Hi.
Hi. I just want to make a little observation. This has been such a kind of uplifting HHS meeting because I hear all of these amazing collaborations that are brewing, and I'm very excited about it. So can't wait to be a part of them. So a couple of updates from HSC. We are in health insurance open enrollment right now. HSC has 2 health insurance navigators. As you know, we are anticipating that health insurance premiums are going to go up significantly next year. And especially, of course, if the tax subsidies do not get passed at the federal level. So just to kind of give you an example, someone who is making like $65,000 this year would have received like a $500 a month tax benefit. And next year, if the extensions aren't renewed, they will receive nothing. So it's a big hit for lower income households. So, but please, if you can spread the word, you can call 211 and make an appointment with a health insurance navigator, and they can help you kind of think through and walk through some of the options that are available to folks. I don't know if Brittany's still there, but I think the other volunteer that you were trying to think of was Jeff Jacobs.
Oh, yes, thank you.
Right, Brittany? Okay. I went back and looked at your email and I found it. So I have some good news on HEAP. We were talking about HEAP earlier, and I wanted to let folks know that United Way and 211 are working in partnership again to partially reopen the ALICE program to support folks that are HEAP eligible and that are facing a utility shutoff or need heating fuel. So it's not a huge amount of money, but if they are eligible and if funding allows, United Way will make a one-time payment for the amount of up to $500 for folks who are HEAP eligible. So again, call 211 and we will connect you with what we can connect you with.
Thank you.
Yeah, and then one other thing, which is more bad news, unfortunately, and I believe that we're going to give a little bit of a deeper dive next month, hopefully, or at some point soon on, I know this is not HEDC and this isn't housing, but the continuum of care, there are significant cuts being proposed at the federal level through our continuum of care funding. They're really shifting their priorities for funding from kind of permanent supportive housing to transitional housing and kind of treatment mandated and treatment first models. Very, very different from what their approach has been over the last 15 years. So there will be a lot of planning needed over the next 12 months or so to prepare for potential decreases in housing funding through our COC.
I think it would be great to come and do a deeper dive in December. It would be great if it was and transitional housing to what we're currently doing, because that's a big piece that's missing, but you can't focus on one and take out the other. Like, it just doesn't. So yeah, I would be great if you could come in December so we can take a deeper dive and get a better understanding with this group. Shawnee, you grab the mic.
Oh, I was going to say something about like forcing people to go to treatment has worked so well in the past.
Absolutely.
I'm sure it'll work great in the future.
Yes, indeed.
Anybody have anything else for Cindy? All right. That is it.
Thanks.
JR he's at a conference today, and so he sent a memo. I'm not going to read everything, but they had quite a few events over the week of Veterans Week. On the 10th, they hosted their twice monthly session of New Veterans Crochet Group. On Tuesday, November 11th, they had staff attended Veterans Day ceremonies in Ithaca, Dryden, and Groton. They co-sponsored a dine and a discuss honoring women's veterans with Delta Sigma Gamma Theta sorority at GIAC. It was a great luncheon, a great conversation. They watched different clips from the 6888, and they had 3 generations of female veterans there, which was really cool. They hosted their twice monthly session of Warrior Writers. On the 12th, they co-sponsored the Veterans Coffee House at McGraw House with McGraw House staff. On the 14th, they co-sponsored the Tompkins County Veterans Resources Expo with the Office of New York State Senator Leah Webb, held at the shops at Ithaca Mall. So they've been quite busy. They've done a lot of good work this month. Jay, I just wanted to make sure I shared some of those things on the record. Appreciate the work that they've been doing. Does anybody have anything they would like to share from the committee? If that's the case, Randy, okay. We are adjourned.
Thank you.
Great.
Thank you.
Thanks, Travis.
You are